Hi, everyone. My name is Denise, and I am the Poison Center educator at the Michigan Poison and Drug Information Center. This week is National Poison Prevention Week, which runs March 16th through the 22nd. The theme for NPPW 25 is, When the Unexpected Happens, Poison Help is Here for You. The Michigan Poison and Drug Information Center is part of Wayne State University School of Medicine. The MiPDC is a nationally accredited poison center with America's Poison Centers, and we help all callers with questions to help prevent poisonings, and we provide expert advice when poisonings happen. It's easy to reach us by calling 1-800-222-1222 and choosing extension 1 for our specialists in poison information. They are registered nurses, pharmacists, and physicians who specialize in all things that could be poisonous. There is never a charge for calling the Poison Helpline, and this service is available around the clock and every day of the year. When we take calls about someone who is sick or may become sick from a poison, they may already be at the hospital. Sometimes our specialists will tell the caller that the patient should go to a hospital emergency room. When that happens, our clinical consulting team steps in. Today, I'm talking with our toxicology fellows, Doctors David Carroll and Aria Darling, about one of the topics that I'm asked about most often during outreach events and educational sessions. That's cannabis. Thank you for joining me for this NPPW event. I've spoken with many people who are looking forward to learning more about cannabis from the MiPDC's perspective. Since the legalization of adult use recreational cannabis in Michigan happened, what are some of the most concerning trends you've seen or heard about related to the substance?
Yeah, thanks so much for having us on, Denise. So probably the most concerning trend we're seeing is the massive increase in pediatric marijuana exposures. And to that, I'm referring to the usually toddlers who will get into what seem like relatively small amounts of THC to an adult, but can result in some pretty severe consequences, potentially even life-threatening. The other trend we're seeing is an increase in CHS, or cannabinoid hyperemesis syndrome, which is a syndrome of recurrent episodes of uncontrollable vomiting, often requiring emergency room visits.
Mm-hmm. And something else to think about is that as people are inhaling more smoke, you are causing irritation to your lungs, and there is a theoretical increased cancer risk that we're worried about. Something else that is alarming to us is that we're seeing an increase in the amount of contamination of marijuana. So for people who are buying in areas of lower socioeconomic status, people who don't necessarily have IDs, they are buying marijuana that's contaminated with fentanyl, and we are seeing fentanyl overdoses from marijuana usage.
And when the MiPDC takes calls about cannabis exposures, what is the most reported age range of the patients, and what are the most reported symptoms for these patients?
So the presentation is in regards to age, what we call biphasic, as in two age ranges are the most commonly presenting folks. The first would be ages 2 to 5. Anyone after roughly 9 to 12 months of age would be at risk because that's when we form that pincer grasp ability, the fine motor control that allows us to pick up a pill or gummy bear or what have you and put it in our mouth as quote unquote exploratory ingestion. Now, this group comes in with by far the most severe consequences. Those 2 to 5-year-olds, they can have consequences with relatively small doses. Again, 10 or 20 milligrams even in a kid that age can result in an ICU level visit. Some things that might happen could be a seizure, low blood pressure, and sleepiness, so to speak. So sleepy that they might require a breathing tube in order to live.
Yeah. And then the second phase that Dr. Carroll is referring to are going to be your 12 to 17-year-olds. So this is the age range where kids go out and start experimenting with things. And, they don't necessarily have an idea of the dose of things that they're getting into. And so these kids present with severe anxiety, agitation, and a lot of times we'll need medications to help them calm down and potentially even things like IV fluids. And they can get so agitated at times it can actually cause kidney damage.
Okay, so Thank you. And the next question is, adults and children can take medications for a variety of health issues. Are there any health conditions or medications that cannabis should not be used with, and why would that be?
Definitely. First, in regards to health conditions, anytime we're exposed to THC, it tends to make us tachycardic or have a faster heart rate. That can be a problem with some folks who have disease of the heart, whether it be coronary artery disease or heart failure due to another reason. It'll increase the demand on that heart as it has to work harder and pump faster. The other group of folks who would really recommend not be exposed to THC would be those on other sedating medications. That could be something that ranges from a benzodiazepine, like Xanax or diazepam, or something like a clonidine or guanfacine, something that a kid or an adult could be taking.
And then, smoke and things definitely can irritate the lungs, as I mentioned earlier. So anyone who has asthma, COPD, we definitely recommend against using THC products. An interesting fact, Dr. Carroll, is that in the first 60 minutes of using a THC product, you have a 5 times higher increased risk of a heart attack. And the last thing I think of note is that in patients who have underlying psychiatric conditions, you can actually cause a psychotic break.
I think a lot of people probably didn't know about heart attacks related to this or even think about that. So that's really good information. So the next question is, I spoke with a youth leader, this was last week, and several of them, there were a few youth leaders at this particular meeting, and several of them expressed that teens disregard adult use only. So if they're in environments where cannabis is being used and common in people over the age of 21, is there any advice or perspective that you could share with parents and youth to help these teens make better decisions about cannabis use and prevention?
Sure. Well, I'd probably take a health-centric approach to it, which may be a little bit of a um, skewed lens, as in that's the main thing we focus on. But there are definitely some health risks if you expose yourself to cannabis, especially at a young age. The first domain, I would say, would be in terms of reproductive health. So exposure to marijuana can result in low sperm counts and can result in some female reproductive issues as well.
And then in addition to that, it can interfere with your memory, it can interfere with your math skills. We are seeing that impact kids, especially in school ages.
Thank you. Okay, our next question is, when anyone is experiencing illness related to accidental or intentional cannabis use, how does the clinical consultant team help?
So the majority of care is what we call symptomatic and supportive. When someone comes into the hospital after a marijuana exposure, the main priorities will be making sure their airway is nice and open, they're breathing well, and they have a blood pressure that's sufficient to keep up with their vital organ function. In terms of the specific toxicology involvement, our team will typically be there to kind of advise the level of care and figure out if there's anything else going on as well.
All right, thank you. All right. And why is it so important to keep cannabis containing products locked up and out of sight and reach of small children?
No, that's an excellent question. And, we kind of take the same approach that we do with medications in general. Kids like to see what they see other people do, or like to do what they see other people doing. So if they see you take an edible or try something, they are more inclined to do it themselves.
Yes, we get a lot of calls regarding little ones, and that's a big concern. And that's probably one of the biggest reasons that we're doing this today, is because there are so many people that have asked questions about that specifically, small children getting into cannabis edibles and other cannabis related products. So thank you. Okay, so is there anything else that you feel Michiganders should know about cannabis or products containing different forms of THC sold and found throughout the state of Michigan?
Well, there's a couple of THC related products to probably be aware of. One of the more concerning ones would be THCP. That is quite similar to THC, but with a little extra backbone on the side. That little extra backbone imparts a 33 times stronger effect when you're exposed to it. THCO is another relatively common and legal product. That one is also a little more potent than THC. So users may get an unexpectedly intense effect when exposed. And obviously in kids, the effect will be even more pronounced and potentially consequential.
Thank you. And again, this is information that I feel that a lot of people might not be aware of, and they may be actually getting a hold of these products, and maybe their children are too, and so they just don't understand, why they may be experiencing the severe effects that they're seeing. So thank you for sharing this information today. Is there anything else you'd like to share?
I think the only other thing that I'd like to share is the regulation processes for these medications and the approval process to get them to the public is not necessarily as regulated as it may seem. So sometimes what you think you're getting isn't necessarily what it says that you're getting. So just being mindful that there's still some variation with what you're taking, even if you see a dose on a product. Mm-hmm.
All right. Well, thank you, Dr. Carroll and Dr. Darling, for sharing this important information. I'm sure that we'll be getting a lot of questions after people start viewing this particular recording. So thank you so much for joining us. And for more information or questions, please call the Michigan Poison and Drug Information Center on the Poison Helpline at 1-800-222-1222. You can also find many resources and more information on our website at www.mipoisonhelp.org. For updates from the MiPDC, follow us on Facebook, X, or Twitter, Instagram, LinkedIn, Blue Sky, and YouTube, and of course on our webpage. Never hesitate to call the Michigan Poison and Drug Information Center for questions or if you are experiencing a poisoning emergency. Call 911 or seek emergency medical assistance if anyone is having difficulty breathing, is unresponsive, or is showing signs of physical or mental distress. The Michigan Poison and Drug Information Center thanks everyone who took the opportunity to learn more about cannabis exposure and our work at the MiPDC. To provide feedback about the video, you can scan the QR code that you will see in this slide that I'm sharing in just a moment. There we go. Let me put this up here. So just some brief information. Again, call 911 if anybody is having difficulty breathing, if they're in physical distress or in mental distress. Call the Poison Center at the 1-800-222-1222 if you have questions, because we're available around the clock and every day of the year. And as I said, if you would like to provide some feedback, please scan the QR code, or you can go to mipoisonhelp.org and find that link on our webpage. Thank you, everybody. And thank you, doctors.
Thanks, Denise.